It all begins in a contaminated water source. Drencunculiasis, also known as Guinea worm disease, is an infection caused by the parasite Drencunculus medinensis. This parasite is spread by drinking water contaminated or containing Guinea worm larvae, which are immature forms of the worm. People become infected with the Guinea worm by drinking water from ponds and other stagnant water containing water fleas that carry the Guinea worm larvae. Once drunk, the larvae are released from copepods in the stomach and penetrate the digestive tract, passing into the body cavity. During the next 10 to 14 months, the female larvae grow into full-size adults and are usually 2 to 3 feet long and are as wide as a cooked spaghetti noodle. When the adult female worm is ready to come out, it creates a blister on the skin anywhere on the body, but usually on the legs and feet. This blister causes a very painful burning feeling and bursts within 24 to 72 hours. Immersing the affected body part into water helps relieve the pain. It also causes the Guinea worm to come out of the wound and release a milky white liquid into the water that contains millions of immature larvae. This contaminates the water supply and starts the cycle over again. For several days, the female worm can release more larvae whenever it comes out in contact with water.
The Guinea worms are known to affect poor communities in remote parts of Africa where safe water is not accessible. For instance, in 2014, only 4 countries still had cases of local Guinea worm: Chad, Ethiopia, Mali, and South Sudan. People do not usually have symptoms until about 1 year after they become infected. A few days to hours before the worm comes out of the skin, the person may develop a fever, swelling, and pain in the area. More than 90% of the worms come out of the legs and feet, but worms can appear on other body parts as well. An infected person may also suffer from gastrointestinal problems such as diarrhea, nausea, or vomiting. When the adult female worm comes out of the skin, it can be very painful, slow, and disabling. Often the wound caused by this worm develops a secondary bacterial infection. This makes the pain worse and can increase the time an infected person is unable to function, to weeks or even months. Sometimes permanent damage occurs if a person's joints are infected and become locked.
In 2016, 25 cases of Guinea worm disease were reported worldwide, and just in 2017, there were 14 reported cases in Chad and 12 in Ethiopia. On the brighter side, treatment is possible. The treatment consists of self-care, as the worm can be pulled a few centimeters each day by winding it around a piece of gauze or a small stick. The process usually takes weeks and permanent damage is uncommon. Medicines such as aspirin or ibuprofen can help reduce pain or swelling. Antibiotic ointment can also prevent secondary bacterial infections.
In order to prevent from getting this disease, hygiene is a must, and the disease can be prevented by avoiding drinking unsafe water. Thankfully, there are some simple control tactics that can prevent the spread of this disease, such as drinking water from protected sources that are free from contamination, prevent people with swellings and wounds from entering ponds and other water used for drinking, always filter drinking water from unsafe sources using a cloth filter or a pipe filter to remove the tiny water fleas that carry the Guinea worm larvae, and provide communities with new safe sources of drinking water and repair broken safe water sources if possible. However, there is no current drug treatment nor vaccine to prevent it. Hey, here are some fun facts. This disease is a parasitic animal. It does not come from a bacteria or a microorganism, but from fleas within the dirty water that carry the worm larvae. Also, the name Drencunculiasis is derived from the Latin word affliction with little dragons. And lastly, untreated cases can lead to secondary infections, disability, and amputations.